All right. Hopefully, you guys are all already on your course as far as what you're doing as far as the lifeguarding class goes. Um, I know it's a lot of work, but in doing it online like this does make it a lot quicker. Second here. There we go. All right. So, professional lifeguard and setting the stage for safety. We're going to go through facility policies and procedures, locations of important areas, locations of emergency exits and AEDs and first aid kits, measures taken to ensure your safety during the session. To help prevent and respond to emergencies in both shallow water, hold on, there we go, less than 7
Colin's
feet
Wi-Fi is having
and deeper
problems.
water. What's that, Gio?
I said Colin's Wi-Fi is having problems.
All right. Well, we're going to go ahead and keep going. He can always come back and check the video out later if he can't get back on. You will demonstrate knowledge and skill competency in 4 main areas: foundational lifeguarding concepts, water rescue and extrication, resuscitation, including ventilation, CPR, and AED, as well as first aid, individual and team rescue and response. To successfully complete the course and receive certification, you must attend the entire course and participate in all class sessions, actively participate in all course activities, demonstrate proficiency in all skills, pass the final written exam with a minimum grade of 80%, and pass the final skill assessments. Upon successful completion of the course, you'll receive a certificate for lifeguarding, CPR, and AED. All is valid for 2 years. During the course, you must demonstrate a professional attitude and mature behavior. Be prepared for all class activities, including wear appropriate swimwear for all in-water activities, because you will be in the water. During the course, you must demonstrate a professional attitude and mature behavior. Complete reading assignments, including answering end-of-chapter review questions before each scheduled class. Basically, you got to make sure you have all of your online certification done. Even if it's not completed, I'll probably can wait a day or two to get you finished, but you do need to get that online certification completed. Ideally, if you have it done before Saturday, that'd be great. During the course, you must demonstrate a professional attitude and mature behavior, behave appropriately during activities, work to improve skills during skill practices and skill drills, treat others with respect, follow all pool safety rules, take measures to ensure that your own safety as well as that of others, demonstrate respect for the facility and the equipment. And then during that, we'll have all of our cell phones on silent. You're not going to be using your mobile devices during the class sessions, except when you're accessing digital course materials, which we won't be doing. And you'll secure any items of value or avoid bringing them to class if possible. Talk about professionalism on the job. How can a lifeguard demonstrate professionalism through their appearance and behavior? You can make sure that you're wearing the lifeguard uniform properly, including a whistle, a hip pack or fanny pack, and a rescue tube. You need to be standing or sitting with good posture. You need to stay alert and focus on the activities in their zone at all times. And you need to maintain a positive, safety first attitude. The biggest thing is with the rescue tube and the fanny pack. Your fanny pack will have all your PPE in it, including gloves, Band-Aids, a resuscitation mask. And you always want to make sure that you are wearing that, as well as having the rescue tube around your shoulder and across your lap. The reason is if you actually have to go in the water to get somebody, if you don't have your fanny pack on you, you won't have the proper materials that you need to maybe do resuscitation. If you need to, you'll put your gloves on. So all that stuff needs to be with you at all times. What are some behaviors that demonstrate a lack of professionalism? Using mobile phones or other personal smart devices while on duty, eating or chewing gum while on duty, engaging in conversation with patrons or coworkers while on surveillance duty. That one may be one of the more difficult ones, especially as you're at a pool and the kids start to know you. Young kids always want to talk to the lifeguards. They look up the lifeguards. They always want to be with them. So, if they are coming up talking to you, you can tell them, hey, I'll talk to you when I get off the stand. But the one thing I always did when I was lifeguarding is if I were talking to a swimmer or a child, I would always have my eyes on what was going on in the pool, not what they're doing. While you're sitting in the stand, make sure you're not slouching. Make sure you're not twirling or playing a whistle. Make sure you are make sure you're not wearing the lifeguard uniform properly. That would be one of the things you're doing if you're doing wrong, or if you're not wearing or holding rescue equipment properly. What does it mean to be equipped and rescue ready? It means that you're wearing or carrying the appropriate rescue equipment for your facility, and you're ready to enter the water to perform a rescue at a moment's notice. So we'll have the rescue tube at the instruction next week. The fanny pack, you'll find some hopefully at your pool, and then always have a whistle. Hopefully your pool will supply you one. If not, you can go out and buy one pretty easily. Surveillance and preventative lifeguarding. The lifeguard's role in preventing drowning incidents. As part of your course outline, you watched a video with an interview with a parent whose child fatally drowned at a lifeguard facility. I know if you watched that already, I know it's not easy to watch. There's a couple videos out there that we'll show you one at the end as well that I always think is important to see. But that also highlights the importance of what your job is. And what I will always tell everybody is the first couple weeks of the summer really will dictate how the rest of the season goes. In the first couple weeks of summer, especially those first couple days, that's when younger children are more likely to start having some issues, maybe even just being a distressed swimmer, because while they were ready to swim last year, if they haven't been in the water in the past 9 months, they will have forgotten pretty much everything. Okay. What can you do while you are on surveillance duty to help prevent deaths from drowning at your facility? You want to stay focused, avoid all distractions. You want to use proper scanning technique, continuously scanning your zone, respond with urgency, and always be prepared, wearing the full uniform and carrying appropriate equipment. That last one is probably the most important one. You always need to be prepared to go in the water at all times. What can you do while you are off duty to help prevent deaths from drowning at your facility? You can develop and maintain a strong long-term memory of what behaviors of distressed swimmers and people who are drowning look like. You can attend in-service training sessions. And when you're changing guard duties, some guard is coming up, and if you have Johnny in the water and you know he's struggling, you make sure that that guard coming up, hey, they were struggling a little bit, just keep an eye on them. Even if you're in at a desk, you can always keep your eyes on the pool to see what's going on. Make sure you know and you practice facilities EAP, which is the Emergency Action Plan. Know where to locate and how to use all of the facility's rescue equipment. For example, backboards, AEDs, bag valve mask resuscitators. Make sure you stay healthy and well rested. Jackson, make sure you turn on your video for me. Jackson. Jackson Britton. All right, let's see if he'll listen. I asked a couple of times. And this is how we can tell if people are or not here. If you're not videoed and you're not unmuting, that would entail that you were probably not here. All right. How do you fulfill your primary responsibility of a lifeguard? Sorry about that, guys. You want to make sure you're conducting surveillance. What does effective surveillance rely on? The lifeguard being able to recognize a person who needs help in the water, recognition. Lifeguard knowing how to conduct surveillance using proper scanning technique. Zones and lifeguard station placement that support the lifeguard's ability to recognize, reach, and rescue a person in need of help. Rotation schedules that provide lifeguards with regular breaks to prevent vigilance decrement. Basically, you should be on the stand 20, 30 minutes tops. If you have multiple stands, when I was managing, I would do 2 20-minute shifts with the guards, so they were up for 40 and down for 40. So just try to make sure that you are having a good rotation going on. Make sure you have recognition. What are the characteristics of a distressed swimmer? They're able to keep their face out of the water. They're able to call or wave for help, but they're also horizontal, vertical, or diagonal body position, depending on their means of support, or they're floating, sculling, or treading water. So they're not maybe moving forward. They're just kind of floating, but they need some help and they're going to be yelling at you. So make sure you're paying attention to that at all times. What instinctive drowning response behaviors did you see in the examples of the active drowning video? If you remember that, hopefully you noticed that they were struggling to keep their face above water. They're extending their arms to their side or in front, pressing down for support. So they're trying to get their head up. They're not making any forward progress in the water, and they're staying at the surface for only about 20 to 60 seconds. Why can't an active drowning person call or wave for help? An active drowning person cannot call or wave for help because all of their efforts are focused on just getting that last breath. How might a toddler who is actively drowning appear to a lifeguard? They may tip forward in a horizontal, face down position and be unable to keep their mouth above the surface. They may appear to be doing a doggy paddle, but will make no forward progress. And a lot of times with them, you'll see that they can't get their heads out of the water, and that's really the key. If they can't get their heads out of the water, then we know there's an issue. How might a passive drowning person appear to a lifeguard? They may look like they're floating or drifting at or near the surface of the water, face up or face down. They may look like they are sinking. They may look like they are resting on the bottom in a face down or face up position or on their side, like a shadow or an object, such as a towel or t-shirt on the bottom of the pool. And this one is kind of this is the more difficult one because the passive drowning victim, they're really not moving. And number 3, like they're resting on the bottom in a face down or face up position. A few years back, I had some lifeguards that they did have to go in for somebody who unfortunately had a seizure and they were drowned on the bottom of the pool. And at first, they thought they were just down there swimming. They didn't even realize that it wasn't there was someone not moving because you've got the waves of the water. They didn't recognize right away what had happened. So it's always important to kind of be aware of what people do, what people are doing, and what they look like. What are examples of situations, events, or behaviors that can cause a person to lose consciousness and can lead to passive drowning? An active drowning person who is not rescued before they submerge. They do say you want to try to get to somebody within 30 seconds. A person who experiences a sudden illness, such as a heart attack, stroke, seizure, heat-related illness, or hypothermia in the water. The last 2, heat-related, that's going to probably be more middle of the summer. Hypothermia, that'll be at the very beginning of summer as well as the end. A person who experiences a sudden injury, such as a head, neck, or spinal injury in the water, or someone who is hyperventilation and extended breath holding using alcohol or drugs in or around the water. The hyperventilation, extended breath holding. If you see people try to say, hey, let's see how many laps we could do underwater, don't let them do it. It's not a good idea. It's actually very unsafe to do. Everyone watch. Let's see if this video will play. There we go. Watch this video. These things, how many people walk by this child? child did end up surviving with CPR and everything like that, which was amazing. I have no idea how that happened, but and I'll show you another video that's actually just just severe. But I think it's important to see. You always have to be paying attention to what people are doing. Assuming some of you kind of feel a little bit shocked by some of this. So, what do you take away? If anybody has any comments, what do you have? What do you take away from watching that video? If anybody has a comment, go ahead and speak up.
Yeah, I was just a little confused. Like, was the child, was it not calling for help the whole time? Or,
His face was completely submerged.
okay, sorry, it was just a little
I know it's not the best
difficult for me to
video.
see.
I agree. Yeah, it's not the best video, but for most of the time, that face was submerged.
And
He
then,
kept trying to do somersaults, but if you paid attention with somersaults, it never looked like his mouth came above water. He was just trying to move.
oh, yeah, that's just, and honestly, like, if I were to look at that, I would see that. I mean, I would think that he's just doing somersaults underneath the water and that he was just playing around.
And that's where it's important to be paying attention to, because if you had noticed him doing somersaults, that's fine. But you would have noticed at some point that head was never coming above the water.
Yeah,
And so it's always important to just kind of watch these guys.
I see.
Yep. Anybody else?
I thought it was shocking how like no one noticed after, even with how long the kid was underwater. Like everybody just kind of thought he was just having fun.
I mean, you saw like 5 people just walk right next to him. It was amazing. It is shocking. I agree. All right, let's move on. So drowning can easily be confused with playing. Although there's recognizable behaviors that indicate a person in the water is in trouble, drowning, not every drowning looks the same. Many people don't know how to recognize that a person is drowning. Drowning doesn't look like it does in the movies. An active drowning person can quickly become a passive drowning person if they are not rescued. And if a person does not come up and take a breath for 30 seconds, assume that that person may need help. And I would say most of you probably have goofed around in a pool at some point in your life. And I would guess that probably most of you even have done breath holding games, right? I know I did back in the day. But as a lifeguard, you don't want to see that. And you definitely don't want to encourage it. All right, let's go with scanning. What's the difference between searching and watching? Searching is deliberate, active, and proactive, and requires that your mind is alert. Watching is passive and reactive. What they're basically saying is you can just be looking at a pool, but if you're just looking at a pool and your head starts staring up, or your mind starts staring up to space, you're no longer being deliberate or active or proactive. You've got to make sure you keep your mind alert. And that's why short sifts from the guard stand are actually pretty good. What might cause a lifeguard to miss seeing something that is right in front of them? Maybe think about something else or daydreaming while scanning. So kind of an intentional blinding. Can you think of a time when you have experienced intentional blindness? Sure, most of you can. I know there's been times when I just kind of look like I'm staring at something, but I'm staring out into space. I mean, yeah, okay. So none of you are really driving yet, but maybe missing an exit while you're driving, playing a video game. You were so focused on avoiding one threat to your character that you missed another, or even watching TV and you realize you had no idea what was going on in the show. All of those are intentional blindness. What are some strategies you can use to avoid intentional blindness while you're conducting surveillance? Minimize distractions such as conversations with patrons or staff. Avoid mental activities that take your attention away from evaluating patron behaviors. For example, don't daydream. Follow a specific pattern while scanning, or mentally rehearse what you would do if you needed to make a rescue. Does your ability to stay vigilant start to decline while you are on the stand? Absolutely. And that's where I'm saying kind of the longer you're on, the more active or more likely you are to let your mind drift a little bit. What are things that you can do to improve your ability to stay vigilant? Maintain an active body posture, change position often. You know, when we see lifeguards sitting on the stand, putting one leg up on a bar or slouching, those are guards that aren't really paying attention. Make sure you're always sitting in a good posture. Get enough rest, stay hydrated, make sure you're cooling off between breaks, and engage in light exercise during breaks to keep energy levels up. I mean, light exercise. You're not going to go out and swim a bunch of laps or whatever, but, you know, walking around the pool, picking up towels, those are all light activities or light exercises. talk about zones. So when you're working on lifeguard zones, a visibility drill is done to verify that objects at the bottom and the surface in all areas of the zone can be clearly seen from the lifeguard station. Lifeguard station response time testing is done to determine whether the size and shape of the zone enables a lifeguard to reach a person in the farthest or deepest part of the zone. You're going to conduct a worst case scenario rescue, remove the person from the water, and begin ventilation within 1.5 to 2 minutes. But ideally, you want to be able to get to that victim within 30 seconds of recognition. Why is it critical to verify what can and cannot be seen in all areas of the zone? You want to recognize that a person is drowning or needs help. If a lifeguard has to be able to see and evaluate the behavior and appearance of each patron in their zone, the lifeguard needs to be able to see each patron's head position, body position, arm and leg action, movement throughout the water, and location in the water. What are some variables that affect what a lifeguard is able to see while scanning their zone? The size and shape of the zone, the type of the lifeguard station, the height of the lifeguard station, the patron's distance from the lifeguard station, depth of the water, and environmental factors such as glare, water movement, and blind spots. Also, umbrellas can be sometimes in your way as well. So make sure if you're on a stand with an umbrella, you're not using that umbrella to block your view of the pool. Why is it important to verify that zone boundaries enable a lifeguard to reach and rescue and remove a person and begin ventilation within 1.5 to 2 minutes? Because evidence suggests that if a person drowning is rescued within the first 1.5 to 2 minutes of submerging, ventilations may resuscitate them. Guard rotations. How should a lifeguard rotation be performed to ensure that there is no lapse in surveillance during the rotation? The incoming lifeguard, so the person walking the stand, they're going to scan the zone as they approach the station. The incoming lifeguard and the outgoing lifeguard take turns assuming responsibility for scanning the zone till the outgoing lifeguard is ready to leave the station and the incoming lifeguard is in position and rescue ready. The outgoing lifeguard scans the zone as they walk away from the station. So the incoming lifeguard is going to come to the lifeguard stand. They're going to stand by the stand and say, okay, I've got the zone. The lifeguard that's on the stand, they will then turn their back, climb down off the guard stand. They will then stand to the other side of the guard stand. And then they say, okay, I have the zone. So the other lifeguard can climb up the stand, get in position, get ready to go. Once that lifeguard is on the stand, ready to go, you can just say, I've got the zone. And then the outgoing lifeguard would walk away. Watch a video on scanning. You not watch the whole video, it's a little long. Did anybody see anything there? Nobody?
Was the kid at the end in the top left, did he come back up for air or did he stay under?
The little girl?
I don't know if it was a boy or girl. I just saw someone in the top left go underwater at the end.
Yeah, I did not see them coming. That was a little girl in a pink suit. And if you were watching, she
The
was
mom
tentatively
also snatched her earlier.
yeah, well, different it was a different girl there. So this girl was sitting at the edge of the pool early on. She was going hand over hand as she was moving along the side of the pool. And if you see someone that's going hand over hand, that's someone that maybe doesn't feel very confident in the water anyway, and they went under. I'm assuming that's what they're going to say. It's this girl up here in the upper right is the girl that ends up drowning later. Also, the two girls were jumping on their back and forth, and one of them hit their head. So that's another thing to watch. Up in lane 4, you have somebody later on. Solid, Henry. Good job. What were the two biggest things that anybody saw?
Two people roughhousing at the bottom.
Yeah,
And
both groups of them.
in that lane, she was like dipping them under the water.
Yep. So they kept going back and forth with a dunk in the head. The other one kept splashing in the face, which I never like splashing in the face because it takes away their vision. Also could get water up their nose. The other thing is too, they kept grabbing around the necks, which, to me, I get it, but that would be a big no for me. Did anybody spot that? No. So that's where you got to pay attention. All right, surveillance activity. You make sure that the signal detection theory is a cognitive model that describes a lifeguard's ability to detect and differentiate signals such as distress swimmer or drowning person from noise. According to signal detection theory, when you are scanning, what are the most desirable outcomes? Hits and correct rejections. So you want to make sure you're kind of seeing what noise people are making, what are bad noises, what are good noises, which ones you can look at and see that they're okay. You're going to have people that are screaming for your attention at all times. Sometimes they're just screaming just to get you to look at them. Sometimes they're screaming because they really need help. What are two variables that affect your ability to detect a signal? One could be how much the signal stands out from everything around it and how much you are paying attention. What can you do to increase the likelihood of hits and correct rejections when you are scanning? Reduce internal and external distractions from the greatest extent possible. Don't ever wear AirPods on the guard scan. Keep your mind in the game. Focus your attention on assessing each patron in your zone every 30-second scan. Come to work well rested, stay hydrated, take frequent breaks from surveillance duty, continuously work on increasing your ability to recognize distressed swimmers and people who are drowning. This is a great question. It's a false alarm or failure. So if you go in for somebody that you think needs help and you get to them and they didn't need help, is that a failure? Absolutely not. You're better off checking to see if they need help or not. It may not be desirable, but a false alarm is definitely not a failure. Part of your online coursework, you should have watched a video that reviews emergency preparedness and response at aquatic facilities. What is an emergency action plan, an EAP? An EAP is a written document that guides the action of lifeguards and other staff members in an emergency. So you need to make sure that your pool that you're working at has that written down somewhere. It should be at the guard desk at the very least. What information does an EAP contain? It should have actions that should be taken care of in an emergency, who's responsible for each action. It should also have the address of the facility. So if you're calling 911, you can give them the address very quickly. Why is it important for safety team members to study and practice the EAP? By practicing and studying, it eliminates confusion and helps team members respond with confidence during an emergency. Emergency preparedness and response. In a water emergency, the rescuing lifeguard is responsible for activating the EAP, rescuing the person, providing care as needed, reporting, advising, and releasing the person, addressing contributing factors, and returning to duty. The other thing, if you just have a victim, so you go in for a child, they're drowning, you get that child out, what should you do once you're done getting that child and you're confident that they're okay? What should you do next? Anybody have any ideas, Austin?
You should get their parent.
Absolutely. You take them to their parent and you make sure that parent knows what happened. Why do you do that? Number one, sometimes parents don't always realize that their kid maybe needs a little help. So that parent then has a better idea of what's going on. But number two, even if they didn't completely drown, there is still something called dry drowning, which could affect them maybe even hours later. So make sure the parent knows what happened so they can kind of be aware of what's going on. Watching the injury prevention video. Notice the head's constantly moving. What, anybody see anything?
The chicken fight.
Absolutely. What else?
The people were having like a breath holding competition at the bottom
Yep.
right.
Yep. And what was the last one? There's one other one, at least in my opinion. We'll see if that's what they say. But
Was it
the
the-
football. The football was a Nerf football. What happens with a Nerf football in water?
They get really hard.
It gets really heavy, really hard. So you're throwing that, you start throwing harder and harder. You're going to hit somebody in the head, knock somebody out, hit him in the nose, something. So that would be, in my opinion, the other thing. See if they say that or not. Good. Anybody see it or no?
Yeah, The guy was doing a lot of underwater breaststroke pullouts.
Yeah, he did look. It looked as if he did maybe 2 lengths underwater, as far as I can
Yeah,
tell.
and then
And that's
and then the lane
definitely
next
upset.
to him, the
Yep.
kid, he obviously he was having a bit of trouble swimming. He wasn't having much forward progress.
There you go. And with the one that's underwater, for those of you that know Lynette, years and years ago when Lynette was a young lifeguard, another one of her lifeguards at her pool tried to do 100 meters underwater, ended up drowning and dying. And this lifeguard actually, he had just graduated from high school. He was a state swimming qualifier, so he was a very competent swimmer. But he thought it'd be fun to try to go 100 meters. And sometimes what happens if you try to get too far, you actually lose your sense of need for a breath, and you also can use your sense of direction as far as up and down. So it's important to make sure you don't allow that, nor do you want to be tripping on your own. Austin, you have your hand raised.
What about like the dude that was like he was walking on like the wrong side of the lane?
It looks like there's only one person in most of these lanes anyway, so it's not that big of a deal. But if you see that they have multiple people, you always want to make sure they're doing some kind of circle swimming, or one's got the right and one's got the left, so they don't run into each other on accident. So yeah, that's a good catch.
Right.
Anybody? Go ahead, Austin.
There was like a girl on the side of the pool, like crawling on the side of the pool, like she was hanging on the wall.
Yep.
And there were also like the kids that were like booking it on the side of the deck.
They were flying.
They
Yeah.
were sprinting.
Yeah. And I will tell you too, I don't like life jackets or floaties. Those are kids that really can't swim. So I didn't like that the kids in the life jackets went out further in the pool. You always want to make sure you keep a special attention on kids with life jackets, buoys, stuff that tells you that they're not very strong swimmers to begin with. That's my opinion on that as well. Yeah, Gio.
If you see that like a kid's with their like parent or something, should you give them less attention because they're with an adult, or should you like,
You know what? That's a great question. So my sister was at a pool. Her 2-year-old son was sitting next to her. She turned away, was talking to a friend, and as she turned back, she saw that her son was underwater in a matter of 10 seconds, eyes bulging off his head. He couldn't breathe at all. So absolutely pay just close attention to them because sometimes a parent gets distracted and they don't even realize it. Let's see what they say. All right. So sometimes you may have noticed it was difficult to keep track of what everyone was doing in the zone. It's difficult to know sometimes if you need to intervene. Some of you may not have recognized some of the situation behaviors that were pointed out in the video. As you become more experienced as lifeguards, you'll know it. When there wasn't much happening in the water, maybe they got bored. Like any skill, scanning requires training and regular practice to maintain. When in doubt, it's best to intervene. Developing a strong long-term memory of dangerous situations and behavior aids recognition decision-making. Long-term memory supports working memory by helping to assign meaning to information, and decision-making is faster when long-term memory supports working memory. What are some things you can do to help overcome recognition challenges? You can know what you're looking for. You can carefully look at and evaluate the behavior of each patron in your zone. You can strengthen your long-term memory of behaviors that indicate that a patron needs help by watching videos and taking part of in-service training in-service training sessions with simulations. All right, lowering the risk for infection, rapid assessment, and ventilations. So standard precautions include you should take with every person to protect yourself and others from pathogens that are transmitted in blood, body fluids, or other potentially infectious materials. Why is it important to take standard precautions with every person? Anyone's blood or body fluids might contain pathogens even if the person appears to be healthy. What is the most important thing you can do to protect yourself and others from infection? Cleaning your hands properly and at the right times, for example, after giving care. What personal protective equipment or PPE should you always carry in your hip pack? Disposable gloves and resuscitation mask. You also want to make sure you have Band-Aids in there in case you ever need it. Rapid assessment. Why do you perform a rapid assessment? You're going to ensure your safety as well as the safety of others in the area, and you're going to identify life-threatening conditions that need to be addressed right away. What are the 5 main parts of a rapid assessment? You're going to size up the scene. You're going to check the scene for safety while forming an initial impression of the injured or ill person. You're then going to check for responsiveness using the shout, tap, shout sequence. You're going to open the airways, simultaneously check for breathing, a pulse, and life-threatening bleeding. You're going to give 2 ventilations if the person is not breathing as a result of drowning. And then you're going to provide care based on the conditions found. When conducting a rapid assessment, how long should you check for breathing and a pulse? Anybody know? No more than 10 seconds. So really 5 to 10 seconds. When checking for breathing and a pulse, you notice isolated and infrequent gasps. Is this person breathing? No. The isolated or infrequent gasps are sometimes called agonal breaths. If you observe agonal breathing, the person is not breathing, right? They're just kind of gasping. How is checking for responsiveness different in an infant as compared with an adult or child? You're going to tap at the bottom of the foot. On the adult, you're going to tap the shoulders, right? On the child, you're going to tap the shoulders. How is opening the airway different in an infant compared with an adult or a child? On an infant, you're going to turn their head back to a neutral position. A child just slightly past neutral, and an adult, you're going to tilt the head back to a past neutral position. How is checking for a pulse different in an infant than compared with an adult or child? The infant, you're going to check for the brachial artery. You're going to check it on the inside of the upper arm between the elbow and the bicep and the shoulder. So basically on the bicep. On an adult or child, you're going to check on the carotid pulse on the neck. We'll go over all that with CPR when we do that in person. On the rapid assessment, did you find anything that a person is not breathing but has a pulse? What is the care given for this person? So they're not breathing, they have a pulse. Does anybody know what that is then? You're going to be doing ventilations. You're going to do 1 ventilation every 6 seconds for an adult, 1 ventilation every 2 to 3 seconds for a child or infant. On rapid assessment, you find the person is not breathing and doesn't have a pulse, then you're going to begin CPR. You're going to make sure you have an AED machine on its way as well. You want an AED machine up and running as quickly as possible. For every minute it takes you to get an AED machine running, their chance of survival decreases by 10%. On rapid assessment, you find that the person is unresponsive, but they are breathing and they have a pulse. The care you're going to give for this person is you're just going to put them in the recovery position. If the head, neck, or spinal or is not suspected, they're not suspected of a spinal injury, you'll perform a secondary assessment as the person condition allow. You're basically going to make sure that you're watching to see that they stay okay. The 3 times when you're going to use ventilations, you're going to use it when the person is not breathing as a result of drowning, when caring for a person in respiratory arrest or respiratory failure, and when providing CPR to a person in cardiac arrest. What equipment can be used to give ventilations? A mask or a bag valve mask. What are the key differences when giving ventilations to a child or infant as compared to giving ventilations to an adult? You're going to open the airways slightly past neutral for the child. You're going to go in neutral position for an infant and instead of a past neutral position for an adult. For a child or infant in respiratory arrest, you're going to give ventilations 1 to every 2 to 3 seconds, 1 to every 6 for an adult. What is cardiac arrest? It's when the heart stops beating or beats too ineffectively to circulate blood to the brain and other vital organs. What are some causes of cardiac arrest? Drowning and other breathing emergencies, cardiovascular emergencies such as a heart attack, electrocution, trauma, or toxicity such as from a drug overdose or poisoning. Signs of a cardiac arrest are sudden collapse, unresponsiveness, no breathing or only gasping, so the agonal breathing and no pulse. CPR is a technique used to circulate oxygenated blood to vital organs when the heart and normal breathing have stopped. ROSC, return of spontaneous circulation, or the return of a regular heart rhythm, capable of sustaining adequate blood flow throughout the body. How can we give a person in cardiac arrest the best chance of achieving ROSC? By providing high quality CPR and using the AD as soon as possible. 5 key principles of good CPR. Make sure the person is on a firm, flat surface. Provide compressions at the correct rate and proper depth. Allow the chest to return to its normal position after each compression. Minimize interruptions to chest compressions and avoid excessive ventilations. Single person CPR, you're going to compress the chest to about the depth of 2 inches for a child instead of at least 2 inches for an adult. When giving ventilations, you're going to open the airway to slightly past neutral for a child instead of past neutral for an adult. When should you stop CPR? You see signs of life, right? So that's movement, breathing, coughing. An AED machine is ready to analyze the heart rhythm, not putting the AED machine on, but it's got to be ready to analyze. Other trained provider take over and relieve you from giving compression or ventilations. You become exhausted or the situation becomes unsafe. That situation becomes unsafe, take the victim with you if you can. Single person CPR on an infant, you're going to use encircling thumbs technique or 2-finger technique to give compression. You're going to compress the chest to a depth of about 1.5 inches instead of to 2 inches for a child, or at least 2 inches for an adult. And when giving ventilations, you're going to open the airway to a neutral position, and you're really just going to give a puff. You're not going to do a full breath. Two-person CPR. One rescuer is responsible for giving ventilations. The other rescuer is responsible for performing compressions. When performing two-person CPR, how often should you switch roles? Every 2 minutes, or whenever the rescuer giving compressions indicates that they are tiring. What is the CPR cycle when providing 2 rescuer CPR to an adult? So you're going to go 30 compressions to 2 breaths. For a child or infant, it goes down to 15 to 2, right? What technique should be used to give compressions to an infant when performing CPR with 2 people? Encircling thumbs technique. So that's 1 person at their feet, 1 person at the head. You were the second lifeguard to arrive on the scene. The rescuer completed the rapid assessment and is giving chest compressions. What is your best next action? Anybody know? So you're coming on, I'm doing CPR. What do you think you need to do first?
Clear other people from the pool.
No need to worry about that. What do you think, Austin?
Like ask the rescuer if like they're tiring.
Ask if they're tired, or even ask if EMS has been called.
Yeah.
There you go. You always want to make sure EMS has been called, because if that hadn't been called, check it out. Get it done.
Oh, I thought with
AEDs are idiot proof. What are you going to say, Henry? I'm sorry.
wouldn't you also want to get an AED if you were the second rescuer on the scene?
Yes. So that's like if I tell you EMS hasn't been called, hey, yeah, call EMS, and I'm going to tell you go get an AED machine.
Okay.
Absolutely. An AED machine is a device that analyzes the heart rhythm and advises the rescuer to deliver a shock if an abnormal shockable rhythm is detected. If you're the first rescuer on the scene, you complete the rapid assessment and instructed other team members to call EMS, get an AED machine, and you are now providing single rescuer CPR. When the second rescuer arrives with the AED, what should you do? Anybody? Now, I can't see everybody, so if anybody wants to unmute, they can.
Is it like you can continue the CPR till the AED is ready?
Absolutely. You continue while they're putting it all together. So you're going to continue CPR until the AED is turned on, the AED pads are applied, and the AED is ready to analyze the heart rhythm. Is it safe to use an AED around water? Absolutely. Safe to use an AED on a pregnant person? Absolutely. Is it safe to use an AED on an infant or child? Absolutely. A couple of years ago, some of you may remember up at Kennedy Rec Center, there was a drowning victim. They had an AED machine, but they thought it was for adults only. Had they used that AED machine on that child would have had a much better chance of survival. What criteria should you use to decide whether to use pediatric AED pads or the pediatric AED setting on a person in cardiac arrest? Pediatric AED pads or the setting if available for a person in cardiac arrest who is younger than 8 years old or weighs less than 55 pounds. If pediatric AED pads or setting is not available, you can use adult AED pads and the adult setting on a person younger than 8 or weighing less than 55 pounds. Absolutely. When using an AED machine on an adult, how should the AED pads be placed? Upper right and the lower left side of the chest, a few inches below the armpit. When using an AED on a child or infant, how should the AED pads be placed? Child, it's the same as you would for an adult unless they're touching. If they're touching, you're going to go one on the back, one on the chest. Same on the infant, one on the back, one on the chest. What is obstructed airway care for responsive adult or child? You're going to get 5 back blows followed by 5 abdominal thrusts. How does obstructed airway care for responsive child differ from an adult? You may need to kneel behind a child when giving back blows with abdominal or chest thrusts. So if they're too short for you, get down on a knee, get close to their height. 4 situations when it's appropriate to use chest thrusts to clear the airway of an adult who is choking. You cannot reach far enough around the person to perform abdominal thrusts. The person is obviously pregnant or known to be pregnant. The person's in a wheelchair, which features that make abdominal thrusts too difficult, and back blows and abdominal thrusts are not effective in dislodging the object. Obstructive airway, you're going to do 5 back blows, 5 chest thrusts. You're going to hold them in the palm of your hand, though, with their either chest or their back right along your forearm. If an infant who is choking becomes unresponsive, what should you do? Lower them to a firm, flat surface, begin CPR, starting with compressions. After every set of compressions and before attempting ventilations, open the infant's mouth, look for the object. If the object is seen, remove it with a pinky sweep. Then provide 2 ventilations, continue compressions. Additional rescuers join the team response and perform various roles as needed. The compressor gives chest compressions. The ventilator delivers ventilations using a back valve mask. The airway manager places and seals the mask and maintains an open airway. The AED operator operates the AED. With multiple rescuer team, you're going to switch roles every 2 minutes or after 5 cycles, 30 compressions and 2 ventilations. The most effective coordinated team response is needed. You need to have critical thinking, decision-making, and communication. Every team member needs to recognize what to do and be able to do to perform whatever role is needed. And team members must be able to anticipate their own next actions in addition to anticipating the actions of other team members. We're getting close here to being done. Secondary assessment. When a person becomes suddenly ill or is injured, if the rapid assessment does not reveal any immediate life-threatening injuries. So if you can't see what's going on, you got to keep trying to find out what's wrong with them. What is the purpose of a secondary assessment is to obtain additional information about injuries or conditions that may require care and could become life-threatening if not addressed. What information should you ask the person when you're obtaining a focus history? You're going to use the sample method. You're going to ask for signs and symptoms. You're going to ask for allergies, any medications they're taking, past medical history, last oral intake, and events leading up to the incident. How do you conduct a focused examination? Check the part of the body that the person says hurts and is holding where you see the obvious signs of injury. Look and gently feel for signs of injury. Check the person's ability to move the body part unless they are unable or unwilling to move it. Notice how the person's skin looks and feels and take note of any medical identification tags. If a person is having a seizure in the pool, what should you do? You're going to activate the EAP. You're going to enter the water and support the person with their head above water until the seizure ends. If you're in deeper water and you don't feel comfortable, you can also extricate them and then sit next to them while you're waiting for that seizure to end. What's the most important first aid action you should take if you think a person is having a heart attack? Activate the EMS system. Call 911. External bleeding, and we'll do that later. I'm not going to watch this video. RID factor is recognition. Lifeguard fails to realize that a person is in distress or drowning. Intrusion, the lifeguard is attending to secondary responsibility while also conducting surveillance. And distraction, the lifeguard is distracted by something that takes away from their attention from the surveillance. So those are things that could cause you to have issues in the pool. When you're conducting the surveillance, how can you minimize the RID factor? Know what behaviors the distressed swimmers and people who are drowning look like. Watch videos and take part in service training sessions with simulations. Never allow secondary responsibilities to interfere with patron surveillance. Make sure another lifeguard is taking over surveillance duties from your zone before you begin working on other assigned tasks, and minimize internal and external distractions as much as possible. Geo, a water polo player gets hit in the head with the ball. Water polo players all the time. After the hit, the player appears dazed and seems confused. The game is stopped. The player is able to exit the pool with assistance. What injury should the lifeguard consider in this situation? Probably concussion. What first aid should you be able to give? Should be given to this water polo player? Activate EAP. Instruct someone to call EMS to get the equipment. Have the person rest without moving and care for any other injuries that may be present according to your level of training. And if EMS is not called, advise that person to follow up with a healthcare provider as soon as possible for a full evaluation. If the player starts to feel better, should they be allowed to return to the game? Absolutely not. If you think there's a concussion, they're out. When a person is injured in the water, when should you suspect a head, neck, or spinal injury? If you witness the high impact towards the head, or if the person has signs or symptoms of a head, neck, or spinal injury. When should you use inline stabilization and spinal motion restriction techniques to rescue and remove a person from the water when you suspect a head, neck, or spinal injury, but that person appears to be breathing? A lap swimmer suddenly submerges and is rescued from the pool bottom. At the surface, they do not appear to be breathing. What would you use a rapid extrication technique or extrication with a spinal motion restriction? you're going to get out of the water quickly. There's no reason to suspect a head, neck, or spinal injury as the person does not appear to be breathing. So the priority is to removing them as quickly as possible. Patron dives off the diving board, strikes another patron in the head, in the water, and goes limp. When turned face up, they appear to be breathing. Would you use a rapid extrication or extrication with spinal motion restriction? Here, you're going to use the spinal motion restriction, right? Because they are breathing. Don't worry about our wakeboarder. What are examples of life-threatening conditions that would take priority over possible head, neck, or spinal injury? Respiratory failure, cardiac arrest, or life-threatening bleeding. All right, before I let you go, we're going to watch. One last video. I'll fast forward a little bit here, but just to kind of give you an idea of what's going on. There's a child right here that's being circled. So he's been playing with one of the lifeguards, one of the camp counselors, and being dunked multiple times, which we've done. I mean, I personally have done many times. There's a lifeguard station here to the right. I know it's a bad video, but you'll get the idea of it. Yoni was a 4-year-old at this camp. And we can't see that lifeguard. You see another lifeguard coming into view. I know the lifeguard over here in the right has just sat down in that chair. So there is a lifeguard just sitting there. The circle with red is Yoni. See the lifeguard getting up. Now, at this point, Yoni is completely submerged. Again, you can see how close he is to the lifeguard. We'll go ahead and fast forward a little bit here. Still floating. This is about 4 minutes later. And this video really is more just to highlight how important of a job you have when you're lifeguarding. Fast forward another 2 minutes. So almost 6.5 minutes later, finally somebody notices Yoni. There's a lifeguard walking away again. You can see how close that lifeguard was. That ends up in a bad way, obviously, almost 9 minutes underwater. That child did not make it. But the point is, he was 5 feet from that lifeguard at all times. It's got to pay attention to what you're doing at all times. Just know it's a very important job that you are undertaking. Thank you all for your time today. I appreciate it. And I'll send out information on Monday about the lifeguarding class that we're doing on Saturday, and we'll get you all started. Have a great weekend. Goodbye.
Thank you, Mark. Bye.
Coach
thank you.
Mark.
Thank
Yes.
you.
Thank you.
Thank you all.